Well, he says during COVID, we opened those Nightingale hospitals in a matter of weeks. Why can't we do that now to alleviate the war zone conditions that are being experienced at the moment? Yet nothing much happened with those, did it? Did anybody ever spend any time in a Nightingale hospital? One here, I live in Newport Gwent, and 8 years ago I lived in Tottenham, and I was an unofficial carer for a housebound emphysema patient. And he had taken to hospital, put in a cubicle and died. When a relative visited, he was directed to the cubicle and found that his dad was dead inside. And it's those kind of stories, sadly, we are seeing too much of. And the Royal College of Nursing analysis, 5,000 staff were asked about this. Patients dying in corridors, sometimes going undiscovered for hours, according to this report. Last week was the busiest yet for the NHS this winter. Almost 1 in 7 occupied hospital beds taken up by patients medically fit to be discharged. Let's speak to Dr. John Puntis, co-chair of Keep Our NHS Public. John, good afternoon to you, sir.
Hello, Ian.
I'm tempted to almost guess what your answer might be to this when I say, is there any of this a surprise to you? And I've got a funny feeling you're going to say, no, it isn't.
Well, I don't think it is a surprise, is it? And everyone knew that there was going to be a winter crisis because there always is. These accounts by the RCN are absolutely heartbreaking. And if you think of the suffering of patients and of staff, it's really terrible. And this is systemic failure in the NHS. As you've said, you've got 1 in 7 beds that are filled with people who are fit to go home, but they can't because there isn't community support and social care. That means you can't transfer sick patients to A&E, from A&E to the wards. That's been associated with 14,000 deaths each year. Yeah. You've got trolley waits, which 12 hours on a trolley, they were almost unheard of 15 years ago.
Sure.
They've now over 500,000, and they've gone up by a factor of 23 times just in the last 4 or 5 years. Yeah. Because A&E's full, you can't get patients in. And we heard yesterday in the press that ambulance crews are missing 100,000 999 calls every month because they're tied up with waiting outside A&E. So this is a catastrophic crisis in acute care, completely missed out by the recent announcements on the elective care recovery plan, so completely separate to that. But this is really, should be absolutely the highest priority now for Wes Streeting and others in government to sort out.
Is the problem, John, ultimately, whatever way we slice it, we can all have different ideological ideas about how a health service should run, and you're correct to identify that the social care component to this is almost the main problem, some would argue. But even if you sort that, a lack of clinical staff is still an overriding problem here. You could put as many scanning machines in there. You could even up the beds back to 1998 levels, nearly 300,000. You could do all of that stuff. But if you haven't got the staff to work within it, there's still a problem.
Yeah, completely agree. So we have 107,000 staffing vacancies at the moment. I think 32,000 nurse vacancies, and that absolutely has to be addressed. We also don't have the room and the facilities, as we've heard from this report. And these were all things that were highlighted in the Darcy report, where he made some very useful and important observations. One is that there's been very little capital funding coming through. There's now a 14 billion maintenance deficit. We don't have the space to be able to deal with patients properly, as well as not having the staff. He also pointed out that if you think changing to some kind of different system was what was needed, pointing out that they were going to be more expensive, so you'd still end up spending more money. And he said, we can't afford not to invest in the NHS because of the impact it has on the population and the impact it has on the economy, all very important points.
So in the first instance then, if Wes Streeting was here now, John, what would you be telling him to do first to address this?
Well, first of all, I'd have to say social care. They've organised a review of social care, which we'll report in 2029. Well, we know what the problems with social care are. Get on and do something about that. Increase community facilities and support, and then you'll be able to get patients out of hospital. What we need at the moment, we do need more beds. More staff is absolutely critical, so we should be looking at how we get staff to stay and not leave, as well as recruiting more staff by making the jobs attractive. This means bringing back things like nursing bursaries, of course, and these are really important things to be done urgently.
And in the sense of urgency, I mean, what does urgency look like? Because we know, significant change, seismic change in the NHS is like turning an oil tanker around. It doesn't happen in months or, even a couple of years. This could be a decade or more just to even get back to a semblance of acceptability.
Well, one thing I have to say is to make some emergency funding available now. We have a situation where the integrated care boards are having to find 8 billion in efficiency savings. What are they doing? They're cutting staff, or they're not employing staff. They actually need money so that they can hire staff to help in this very busy crisis that we're in now. So I'm afraid that there is no getting away from increasing the funding. That should be done urgently. We know that one of the things that New Labour got right was to recognise if you wanted to improve waiting lists and public satisfaction, you actually had to put extra money into the NHS, which is what they did. And it wasn't their deals with the private sector that made a difference. It was actually that increased investment.
But the private sector did pick up the slack, didn't it, for certain procedures in the independent sector treatment centres, as I think they were called at the time. And that is something I would imagine that your organisation, the Keep Our NHS Public, would resist.
Well, we would point out that the investment could have gone into the NHS. It didn't have to go into the independent sector. And actually, the ISTCs turned out to be relatively inefficient, and they cost more, and that was all very clearly exposed by the all-party parliamentary group that investigated them. So we don't want to go back to that situation where we're actually turning to the private sector to sort things out. OK, on that point, John, thank you for your time, sir. Dr. John Puntis, co-chair of Keep Our NHS Public. Over to you on this one. What is the what's the beginnings of an answer to this? How do we resurrect the NHS? And I think more fundamentally as well, we can take your ideas on that. If you work in that industry, whether you are a doctor, a nurse, a paramedic, all the jobs that are in between that, when you might be at the coalface in the sense you work on the reception at A&E. I mean, I can only imagine what kind of job that is at the moment, when waiting lists are off the scale, people clearly getting angsty about the fact that waiting lists have been there, sitting there for 10 hours waiting to have their patella looked at. I can see the problems there. So whatever aspect you work within, 0344 499 1000. And when you hear that incredible list, that horrific list of patients having cardiac arrests in corridors, dying people left on trolleys, undiscovered, women miscarrying in side rooms, patients being put into the car park, elderly being left to sit for days on chairs, spending hours in beds, nobody changing the beds, they're soiled. What's your own experience of how bad you have seen it?